Hi, I'm Dr. Scott Greenberg from Greenberg Regenerative Medicine, and often I see patients that have a tilt in their pelvis. These could be patients that have hip problems, often they have lower back problems, they could have knee problems and foot and ankle problems, and sometimes these patients can walk with a limp, and the limp may be due to the tilt in their pelvis. I can tell you, in doing regenerative medicine for over 23 years, I don't think I've ever seen a patient with lower back pain that does not have a tilt in their pelvis. The patient may not know it, but it's there, and helping to reverse this tilt, which we do through prolotherapy, can be very helpful for the patient. But there's some other things that the patient needs to do as well, and they involve a ball and the wall. So part of the reason why the pelvis gets tilted is having too tight of an iliotibial band. And our quads and iliotibial band get too tight, and our hamstrings aren't strong enough to compensate for this. So what we need to do is to take the ball, put it right above the knee, and then twist this way, essentially kneading the ball into the iliotibial band and trying to push it forward. And we knead for a few seconds in each area and slowly move it up the hip until we get to the point of the hip. It may be painful, especially when the iliotibial band is tight, but unfortunately you have to persevere a little bit of discomfort to help to make your body progress. So keep doing it till you get around here, and I would try to do that at least once a day. If you're a cyclist, you may need to do it more often because cyclists' hips get very, very tight. Believe it or not, most patients, it's much more important to do it on the left side than the right side, but there's really no reason why you can't do both sides. So that's one important thing. The second important thing is to try to open up the front of the body and try to loosen the psoas. And we do that by putting our left leg back, right leg forward, and reaching up in the air and arching back, thus stretching out the entire muscular chain in here. Again, this is a really important stretch to do if you have a tilted pelvis, have back pain, have hip problems, or have knee problems, and it helps to get your pelvis realigned and helps to stretch the muscles that get overly tight that lead to the tilted pelvis.